Okay, so we're talking about Zerona and getting started, and so I have a couple questions for you. And the first one is, I noticed when I was filling out that form that it said no alcohol consumption. Is that for the 2 weeks in Zerona or for the 30 days doing the program with the curve is starting the week before?
Yeah, but it really ought to be for the full 30 days because alcohol generates or it contains a lot of sugar also in the drink, and that's going to generate more fat. And the whole goal is to be creating the conditions in the body that are going to be burning the fat. So you don't want to out-compete your body's trying to burn fat for you by introducing a bunch of new fat.
Okay.
And alcohol is notorious for a lot of sugar in a small amount, small volume.
Right. So when do you recommend being able to incorporate kind of normal lifestyle back into the?
I would give it another week after treatment, so that pretty much gets you the 30 days.
Okay.
A week before, 2 weeks during, a week after, should be 30 days. And then that should be good enough.
So it sounds like it might be kind of a good cleansing system in general for liver, kidneys. A nice break, 30 days is pretty good.
Yeah, that's the idea, to get fat prepared and more inclined to be removed, cooperate a little bit with the lymphatic system that's trying to transport it back to the bloodstream, then onto the liver and out of the body, the normal detoxification route. And so it's a great opportunity for detox.
So is other detox things good, like green teas and?
Yeah, the curva is a nice centerpiece with the L-carnitine, which is like taking a shovel to a pile of fat and throwing it in the furnace. And then green tea is sort of along the same lines. It's a great antioxidant, good fat burner. And then the niacin, the vitamin B3, is also important in that process. But we've also considered and are going to implement some omega-3 fish oil and alkaline drops for the water, which will raise the pH of your water, help you burn more fat. Fat does not do well in an alkaline environment, so the more you can liquefy and get rid of, the better. And then the green tea and ephedra juice drink, Zemo, is a pretty good tool to use. All these things can be done at once and help that fat burning and detoxification process.
Cool. And then it talks about diet, and it says sensible diet. Do you have any recommendations for what's considered sensible diet?
Well, for those of you who recall the HCG diet, the maintenance phase, or the just after the maintenance phase, you could say, which is really limiting the starches. In the case of the HCG, it says no starches, but very moderate to low starches, and if you can stand it, almost no starches. But then a generous amount of lean, grass-fed protein, organically raised meat, and then same with the eggs, same with the dairy. Eating those types of things first in your diet, and starting to get back into the almonds and the walnuts, and of course the greens, obviously. And as far as treats go, like I say, limit those down, and then like with the alcohol as well.
Is there a specific amount of calories we should be looking for to stay under? Or?
I would have to say, now in the HCG maintenance, you're probably upwards of say 1,200. I'd say if you could go 12 to 1,500 and cap it at that, structure it well with protein at every meal and snack, a little bit of your daily total, so you're always getting some of the first out of everything you eat, every time you eat, and that will really create great fat burning conditions for the body.
Eat protein first?
Eat protein first, and depending on your size, shooting for 80 to 100 grams or even 120 grams if it's a larger guy, grams of protein per day, and then you want to divide that by 3 meals and 2 snacks, maybe 5 opportunities to get that total for yourself. And if you get that much during the day, your body will use its stored fat as fuel instead of tapping your muscle and organ protein reserves if you don't eat enough each day. So that's the idea with getting enough protein.
And for exercise, it's different from HCG diet. This one, it says to exercise, like walk minimum of 10 minutes if you don't already. What about like maybe doing light weights?
Yep, I would say keep in mind when we hear about light weights or resistance work in general, your body stays warm and heated, metabolically efficient for about 24 hours after a good workout. And with this program allowing for a reasonable number of calories, a more normal complement of calories, you do have the surplus of the reserve to engage in some in pretty intense exercise. And it's a great time to do it because you've got all that free fatty acids and triglycerides being freed up by the supplements, by the Zerona treatments themselves. You've got a lot of fuel to burn. You usually don't have access to free fat floating around, and it's a good time to use it up. It's going to sit in the liver ultimately at the end of this detoxification process, and it's one of two things. You're either going to eliminate it in the bathroom, but that'll take a little longer than if you can help the process and expedite that process with using it up in cardio and resistance work.
Cool. I think that's it for questions. If I can think of anything else, we'll pick up some more.
Cool, thanks.
All right.